Series of the cranial nerve, we are going on to the last nerve, last not but the second last, that is the cranial nerve number 11. After that we will have the cranial nerve number 12, and then we will be done with our cranial nerves. So first of all, we are going to do and find out where the cranial nerve number 11 comes out from, how many roots it has, and how many nuclei it has. So here we have a look at this diagram. It is showing the medulla oblongata, and medulla has this nucleus which is known as the nucleus ambiguous, and from here we are going to have the cranial root of the accessory nerve going to come out. Now this cranial root of the accessory nerve, it comes out from the region that is between the olive and the inferior cerebellar peduncle. First you need to know what is the actually association with the medulla. So medulla has these pyramids in the center. Then on the side or posterolateral side, it has these olives. These are pyramids, these were olives, and then this is the inferior cerebellar peduncle. And if you make your midbrain, the brainstem, then the peduncle which connects your pons to the cerebellum is the middle cerebellar peduncle, and the medulla to the cerebellum is the inferior cerebellar peduncle. So the region between the olive and the inferior cerebellar peduncle, we are going to have this cranial portion or cranial root of the accessory nerve coming out. Similarly, for the spinal root, we have the nuclei which are going to come from the C1, C2, C3, C4, C5 regions, and it is going to come out and make a nucleus. That nucleus will be the spinal root of the accessory nerve. It will move forwards. Now both these fibers, this one that is coming from this region, it is going to receive fibers from the cerebral cortex. So these fibers, they are coming from the cortex, coming to the nucleus ambiguous, so they will be known as corticonuclear fibers. Similarly, they are the cortex, coming from the cortex and awaiting the nucleus. These are also the corticonuclear fibers. That is how we have the two roots of the accessory nerve, which is the cranial nerve number 11. It has a cranial portion coming from the medulla between the olives and the inferior cerebellar peduncle, receiving the corticonuclear fibers. And the spinal root comes from the C1 to C5 and also receives the corticonuclear fibers, and both of these are the afferent fibers. Now, one thing that you need to know about the spinal portion or the spinal root of the accessory nerve is that it is going to come from the anterior root of the spinal cord gray horn, and then it now emerges out, but it moves between the anterior as well as the posterior root. So emerging at the anterior gray column, then it is moving. How and where it is moving? It is moving through the or between the anterior and posterior roots. Then it is going upwards. Through its moving upwards, it passes through a region in the skull which is known as the foramen magnum. Then it joins with the cranial root. So this is how the lower or the spinal nerve is coming upwards, passing through the foramen magnum of the skull to reach with the cranial root and move forward as the accessory nerve for a short period of time only. Now similarly, you can see this was the spinal portion, this was the cranial portion. Cranial portion is coming, the spinal portion comes via the foramen magnum, and both of them then pass through the jugular foramen and they move together for some time. But now the cranial nerve, it moves a little bit away, and now it moves with the vagus nerve to form a part of the pharyngeal plexus which supplies the pharyngeal as well as the recurrent laryngeal branches. And these pharyngeal and the recurrent laryngeal branches will then supply the pharynx, larynx, and the soft palate. And this was the cranial root of the accessory nerve. Now the spinal root, after moving to the jugular foramen, for some time it moves with the cranial root. Then it moves downwards and moves to the region of the neck. In the neck, if it goes deep, then it supplies the sternocleidomastoid muscle. Then if it passes through a triangle, it supplies the trapezius muscle. So now if you look at this diagram, you can easily see that this is the portion which is the cranial portion. It is coming out, and then it is going to supply with all the muscles of the pharynx, larynx, recurrent laryngeal apparatus and pharyngeal apparatus, and it moves with a vagus nerve that you can see over here. Similarly, this is the spinal root. It is going to come downwards. One is going to go deep and supply the sternocleidomastoid muscle. other is going to pass through a triangle and supply the trapezius muscle. So any lesion that will be occurring in the portion of this region, or the portion of the accessory nerve, we are going to have no movement in our pharyngeal apparatus, in the larynx as well, and our sternocleidomastoid muscle will not be moving as well. Since we know that this accessory nerve is a motor nerve, so any damage to the cranial root of this nerve, which supplies the pharynx and the larynx and the soft palate, we are going to have difficulty in moving these portions. So we will not be able to talk, we will have slurred speech, we will not be able to swallow, we will not be able to produce voices. The pharyngeal apparatus, laryngeal apparatus, soft palate, all of them will not be able to perform their motor functions. Similarly, the sternocleidomastoid or the trapezius muscle, if they are affected by any damage to the spinal root of the accessory nerve, what will happen? These two muscles actually help a person to bring their shoulder up and perform the functions related to shoulder. But whenever there will be difficulty, or there will be lesions, or there will be any disruption in the supply, the shoulders, they are going to droop down like this. A person will have very imperfect posture, and they will not be able to pull their shoulders up, and the posture will be very bad. So this is how the cranial nerve and the cranial root and spinal root of the accessory nerve, damage to them can cause our normal and daily life to be very badly affected. And always remember that the accessory nerve is a spinal nerve. In the next video, we will talk about the cranial nerve number 12, which is the last nerve. Meet you in that video. Till then, please like, share and subscribe. And if you like my videos, then let me know in the comments below. They always cheer me up and I always reply to them. Allah Hafiz.